Hello everybody, hereby we are going to narrate a very interesting story. Our story today talks about intestinal bloodsuckers, Ancylostoma duodenale and Nicatora mecanus. The story starts when a patient with adult worms in his small intestine defecates on soil. Immature eggs in his stool continue to develop in soil. Rhabditiform larva hatches in 1 to 2 days. After 1 week, the larvae multi into infective flariform larvae to start a new chapter in our story. Flariform larvae are active and occur in the upper half inch of the soil. They have a strong positive hygrotropism and thermotropism. However, they struggle against gravity. They have negative geotropism. And these criteria facilitate their access to the skin of the new host. After that, filariform larvae penetrate adjacent veneers or lymphatics, leaving behind a lesion called ground itch, which is pustulation, caused by secondary bacterial infection at the site of entrance of the larvae. And now let's continue the story of this bloodsucker together. Flariform larvae are carried by the bloodstream to the right side of the heart. To be pumped by the pulmonary artery to the lung, where they molt and penetrate pulmonary capillaries to the alveoli. Then they migrate to the trachea of the patient. However, the presence of this larva in the lung elaborates sniffles, causing Laffer syndrome. At this instance, the patient suffers asthmatic bronchitis and verminous pneumonitis in the form of fever, cough, dyspnea, and even hemoptysis. And herein, airspace disease and upper pulmonary infiltrates are shown in these two radiographs. When larvae migrate up the trachea, they are swallowed, to reach finally the small intestine, where the larvae molt to become adult worms. Head of adult worms is flexed dorsally like a hook. Adult worms have the cup-shaped buccal capsule, provided with 2 pairs of ventral teeth and 2 dorsal plates. Nicatora mecanus, instead of the ventral teeth, the worm is provided with cutting plates. Adult worm attaches itself to the mucous membrane of the intestine using its cutting teeth. In addition, the worm secretes anticoagulants. Each parasite causes loss of about 0.3 cc blood per day due to sucking of blood and mucosal material. In response to the local immune reaction and tissue depletion, the worms change their feeding sites every 4 to 6 hours, causing minute ulcers. The worms disrupt the new venous capillaries with repeated anticoagulant effects. To sustain its existence, adult worms reproduce sexually. After fertilization, each female lays about 20,000 eggs per day. Eggs bath in the patient's stool to the soil. Then the whole story is going to be repeated in another patient. While the worms are enjoying the patient's blood, he is suffering manifestations of hypochromic microcytic anemia due to continued blood loss and depletion of iron stores, in the form of easy fatigue and dyspnea. The patient suffers habitual ingestion of non-food substances as soil, a manifestation termed pica. In addition to physical and mental retardation. Until the patient visits the internal medicine clinic, where the doctor takes a full history from the patient. The patient may also suffer from nausea, vomiting, and diarrhea due to mucosal ulcers of the intestine. Pallor is significant of anemia and can be detected in patient's conjunctiva and palm of the hand. Atrophic glossitis and endocrinitia may also present in severe cases. To build up correct diagnosis, the physician usually demands a stool examination, complete blood count, an oca blood in stool. Professional parasitological examination reveals the presence of Ancylostoma eggs, which is usually accompanied by positive ocal blood in stool. Hyperchromic microcytic anemia and high eosinophilia up to 60%. Albendazole in addition to iron and protein supplementations are treatment of choice. However, the condition might be complicated, especially if the eggs, which are the diagnostic stages, were missed in the parasitological examination, and the condition may proceed up to blood transfusion in severe anemia, a condition which necessitates its detection using endoscopy in some cases.
Right now you can see the hookworm attached to the mucosa of terminal ileum.
At the end of our story, we hope it was interesting for you. Bye bye!